Hi, this is Dr. Doreste with the Cranial Release Technique. Back with another video, and this time something a little different. I was discussing some different cases with a colleague of mine, and we were discussing about different things that have happened. And I remember it had to have been 20 years ago, maybe more. And I was invited to speak to I believe it was a Silva mind control group in Spanish in Corona, New York. And at the time, my Spanish was más o menos. And I went there and I explained the best I could about what is this thing called cranial release. Why is it that these 22 bones which protect the brain, called the skull, why is it that they move, and why is it that they need to move, and when these bones shift and sort of become, for lack of a better word, stuck or restricted, that impacts central nervous system function, which then can impact anything else in the body. That was basically my lecture in Spanish. And it probably went 20, 30 minutes. I took a few questions at the end, and about a week later I got a phone call from one of the gentlemen that was at that meeting. Nice man, originally from Spain, now lived in Brooklyn, hard worker, 55, 60 at the time, I would say. Came in, I said, okay, how can I help you? And he said, well, in his Spanish and my English and my broken Spanish, we went back and forth. Finally, he sort of described what the problem was, and that was that erectile dysfunction. And this is before that term was even, I think, thought of. I didn't hear it. I don't even know if Viagra was on the scene at that time. This is a good 20 plus years ago. And he said, do you think that cranial release could help me? And I said, well, honestly, I have no idea, but there's only really one way to find out, and that's to put you on the table and give you a few visits and let's see what happens. So he was very agreeable to it. I think he had gone to his family doctor, and there was really nothing that they were going to do for him at the time. And so he was a painter, I remember that. And applied the cranial release, let him stay there for a moment, sat him up, we discussed a couple things, and then before he left the office, I would say within 2-3 minutes when I finished, he said to me, you know, for the first time that I can remember, my teeth are now lining up. And I don't recall if he had an overbite or an underbite or something was not right with his bite, but he said, I find it very interesting that my teeth are now lining up. I said, oh, that's great. And I took out my model and I explained that the temporal bone, this brown bone, when the temporal bone becomes misaligned, then the TMJ can become misaligned. The temporomandibular joint, the jaw joint, can be misaligned, and that can cause a lot of trouble in the mouth, jaw pain. A lot of patients have dizziness, vertigo type symptoms from TMJ or temporal distortion. And a very simple way to actually see if you do have a temporal misalignment is you could just look at your husband or your wife, put your fingers in their ears, and if you see distortion one way or the other, front to back, top to bottom, any sort of an angular distortion as opposed to your fingers being directly opposed to one another, I know it's hard to see on the video, then that person, I would say, would probably benefit from cranial release. Because if the jaw is distorted, which it is on many people, the temporal bones will be misaligned, the jaw can't function right. There's a lot of issues that can happen there, including things like dizziness and vertigo and TMJ type pain, TMJ, or what's now called TMD, temporomandibular disorders. So that's what he noticed immediately. And he left, and that was probably a Monday, I don't remember, it was a Monday night. And it took him about an hour and a half to get to me. I was in Flushing, Queens. He was way in Brooklyn. He had to take 2 or 3 subways, and it took him a good hour, 20 minutes, 30 minutes each way to get back and forth to my office. And that was a Monday. Maybe he came back on a Thursday or a Friday, and I saw him once or twice a week for a few weeks. And after a few visits, I said, by the way, amigo, what's happening down below? And he said, no problema, todo bien. All's well, everything's good down below, happy. Great. So then we determined how often to see him, and I think I saw him once or twice a month, maybe twice a month. And I was talking to my colleague saying, now here's someone that came in to see me because of a problem as far from what most people think a chiropractor would help you, but obviously under the control of the central nervous system with this erectile dysfunction. And then he came in once or twice a month. I'm going to say 15 years, hour and a half. And then when I left my office in Flushing, we moved to Florida. I referred him to another patient. I moved back from Florida, back to Jackson Heights in Queens, and he heard I was back and he started to come back to me again. So now instead of an hour and a half, it took him a good hour. Now here's someone coming once or twice a month, paying for his visit out of pocket because he was educated, he understood what this was, he knew his body felt better, and he didn't want to stop. Now that I'm here in Florida and he's still in Brooklyn, I again referred him to someone else, so he's under care with someone else. But the point is, he got it. He got the message in a few visits. In back then, my broken Spanish and his broken English, he got it. And he felt the difference. So, aligning the cranium, restoring the primary respiratory mechanism, restoring this involuntary pump. At 55, 60 years old, I want to say he was. So 40, 50, 60 years of stress and trauma still changed. After that very first visit said, hey doc, my teeth line up. I can feel that my jaw, let's see if I can hold this better for the camera. I can see that my jaw is functioning better and my teeth are lined up. And then everything just progressed from there. So you never really know how far this is going to go. But the point of the story is, if you're a practitioner, everyone benefits from cranial release. If you're a CRT practitioner, if you already know what I'm talking about. If you're not a cranial release technique type practitioner, but you maybe are a chiropractor or a massage therapist or an acupuncturist or a naturopath or a dentist, a holistic dentist, holistic MD, maybe you're interested in more about this. This is what you can do with this 1-minute technique. And so if you're interested in learning more about this, you can visit the website, cranialrelease.com. You can click on the button that says online training and you can learn the technique in the comfort of your home or office. If you're not a practitioner, but you say, well, maybe I would like to experience this for myself, then I would again invite you to visit the website at cranialrelease.com. There's a button called Find a Practitioner, and you can search for a practitioner, hopefully in your area, and you can go and get on the table and experience the work. It's very gentle, it's very non-invasive, it takes about a minute to do, and you'll know in a few visits if this is right for you, and you'll know that this is something that you want to continue with, like my patient from Spain, or maybe it's not for you, but honest answer from me, if you ask me, everyone, every single person under every condition benefits with regular cranial release technique care. It's very quite simple. So, the website cranialrelease.com. This is Dr. Doreste saying everyone have a fabulous weekend. Wish you the best. Looking forward to December 2nd for my CRT Mastery Review. I hope you guys are ready because I'm going to flip your wigs when you come down. I got some very interesting information for you. So look forward to that. See you in Fort Lauderdale on December 2nd. And everybody have a great weekend. Talk to you soon. Adios, my friends. Goodbye.